Hello, I'm Ben and you're watching the PhD Parent. As discussed in another video, you can check out the link down below, about 20% of women experience an anxiety disorder during the perinatal period. That is the period that covers pregnancy and about 1 year post-childbirth. In this video, I'm going to provide an overview of research investigating the effectiveness of psychological interventions for perinatal anxiety. As you'll see, the most common intervention which has been shown to be effective in reducing anxiety symptoms is cognitive behavior therapy, or CBT. In another video, you can check out the link below, I provide a brief introduction to CBT tailored to anxiety occurring during the perinatal period. I also have another video that provides a comprehensive introduction to CBT if you want to check that out. Again, links down below. Now, two general points before moving on. First, there's been relatively little research investigating the effectiveness of psychological interventions for anxiety during the perinatal period. I'm not aware of any evidence clearly showing that anxiety symptoms are less responsive to treatment during the perinatal period compared to other points in a woman's life. Thus, the findings reported should be considered against the broader literature, which has clearly demonstrated the effectiveness of psychological interventions for anxiety disorders. And second, most of the existing research is focused on mums experiencing high levels of anxiety symptoms rather than anxiety disorders during the perinatal period. So you can't really draw conclusions about whether these interventions would or would not be effective when an anxiety disorder is present. But see my first point. So on to the effectiveness of psychological interventions for perinatal anxiety. Now, rather than reviewing each study that's investigated the effectiveness of psychological interventions for perinatal anxiety and anxiety disorders, I'm going to report the results of meta-analyses that have examined this issue. And very briefly, a meta-analysis is basically a statistical synthesis of the results of differing independent studies. So I managed to find 5 meta-analyses that have investigated the effectiveness of psychological interventions for perinatal anxiety and anxiety disorders. 2 of these looked at the effectiveness of cognitive behavior therapy, CBT, 2 looked at the effectiveness of mindfulness-based interventions, and 1 looked at CBT and mindfulness-based interventions together. I'll work my way through the findings of these meta-analyses, focusing on the results obtained from randomized control trials, or RCTs. And if you'd like to know more about RCTs, you can check out my video down below. So I'll start with the meta-analyses looking at CBT. First, McGuire considered 7 studies in which CBT was compared to a control condition. The control condition in every study was treatment as usual. In all but 1 study, the focus of treatment was not specifically on anxiety, but was on depression or anxiety and depression. The results showed that the CBT interventions reduced anxiety symptoms to a greater extent than treatment as usual, both immediately following treatment and at follow-up. For stats people, the effect size was in the small to moderate range. Similar findings were reported by Lonen in a meta-analysis of 4 studies that looked at internet-delivered CBT interventions. Now, one issue with the studies considered in these meta-analyses was that anxiety was not the primary target of therapy, and so the impact of the intervention may have been underestimated. However, in a meta-analysis by Clint scales, only randomized controlled trials in which anxiety was the primary target were considered. In this meta-analysis, again, it was found that CBT was effective in reducing anxiety symptoms. For stats people, the effect size was large, though if you got rid of potential outliers, it fell to moderate. So the results of these meta-analyses suggest that CBT is an effective approach for perinatal anxiety, even when delivered online, and there's now a decent body of evidence, with 20+ studies having been conducted. So next, onto the meta-analyses looking at mindfulness-based interventions. So a meta-analysis by Dillon examined 3 RCTs that involve recruiting women experiencing elevated levels of anxiety. And a meta-analysis by Lever Taylor examined 6 studies, 2 of which recruited women experiencing elevated levels of anxiety, and the remaining 4 studies recruited women primarily experiencing symptoms other than anxiety, but reported the impact of the intervention on anxiety symptoms. For example, the intervention recruited women who were depressed and reported changes in anxiety symptoms as a secondary outcome. The findings in this meta-analysis were based upon the results of both RCTs and non-RCTs, with no way to separate the findings from these 2 different types of study. Now, the findings were consistent across both meta-analyses. There was no evidence that mindfulness-based interventions were effective in reducing anxiety symptoms relative to the control condition, which was commonly a waitlist or treatment as usual. However, the sample sizes in the studies considered were typically quite small, for example, 30 participants. There was variation in the type of mindfulness procedures used, and as mentioned, some of the studies were not specifically focused on treating anxiety. However, in the meta-analysis by Clint scales, as mentioned, only studies in which anxiety was the primary target were included. This meta-analysis considered 7 studies in which mindfulness was compared to a control condition. And this time round, it was found that mindfulness was effective in reducing anxiety symptoms. For stats people, the effect size was large, though again, if you got rid of potential outliers, it fell to moderate. So in summary, there is evidence that mindfulness-based interventions are effective in reducing anxiety during the perinatal period. But unlike CBT, it looks like anxiety has to be the target, which is pretty reasonable if you think about it. And the evidence is not as well developed as CBT, in that more than twice the number of studies have investigated CBT compared to mindfulness. So if it's the case that CBT and mindfulness are both effective in treating perinatal anxiety, then one question you might ask is, are these differentially effective? Now, if you wanted to know whether there's a difference in the effectiveness of CBT versus mindfulness for perinatal anxiety, then the most appropriate way to do this would be to pit these two interventions against each other in a study. However, to date, this hasn't been done. So the next best thing to do is compare the magnitude of reduction in anxiety symptoms you get in studies looking at CBT compared with studies looking at mindfulness. And this is what Klimt scale did. And there was no evidence that one intervention was superior to the other. Thus, in summary, looks like both CBT and mindfulness are effective treatments for perinatal anxiety. And while there's no evidence of a differential impact on anxiety symptoms, because CBT has a stronger evidence base, in the sense that more studies investigating its effectiveness have been carried out, I'm going to give CBT the win. So that's it for perinatal anxiety interventions. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.